Hey, it's Dr. Goodwin, your vet cardiology concierge, coming to you again to talk to you about our feline friends and their heart disease. How do we know if a cat has heart disease? That can be tough. Cats do not make anything easy when it comes to that because they like to play coy, they like to play shy, they like to keep their cards kind of close to the vest. They don't like to let anybody know when they're sick, which makes it a little tough sometimes for us to catch the signs of heart disease in cats early. So what are some easy things that can help us out? Well, one, if you're a veterinarian while listening to your cat, here's a heart murmur. A heart murmur can be a sign that there's some abnormal blood flow going through your cat's heart. That abnormal blood flow may be nothing, but it may be that we have some type of heart disease present. Now, not every cat that has heart disease will have a heart murmur, but that is a nice little check that we can do to kind of keep our eyes open and keep watching out for our feline friends. Another test that we have that your vet may use is called the cardiac pro-BNP. This is a test they use to assess for any heart muscle stretch. So a lot of times if you have a heart that's getting bigger or getting thicker than it should, then that heart might show release of more of this hormone called BNP. That BNP hormone getting released would cause elevations in the pro-BNP and let us know, hey, we should take a look and see if there's any significant heart disease present. Other signs that cats might show: hiding more. You'll get a change in how social they are. Instead of being with you like they normally would be, they go and seclude themselves off somewhere. Although that's not specific for the heart, you often can get a cat that will do that when they have heart disease. Another one that we can see is decreased exercise tolerance. Well, what do I mean by exercise tolerance? Well, some cats will run around, run, play. Some cats will spend most of their days sleeping. But if you have a cat that's usually walks across the room and then walks back across the room, and now that same cat's walking halfway across the room, laying down for a moment, maybe breathing a little bit faster, then gets up to complete the walk or the journey, then that might make me wonder if there's something going on that we may need to investigate further. Another one that we'll see cats do that can be annoying to owners is they often, when they have heart disease that's bothering them, stop using the litter box. They'll come really close, drop a little gift here, drop a little gift there, right by the litter box, but they won't go in. Again, that's not specific for heart disease, but it can be a sign that we use to say, hey, my cat is not feeling okay. Aside from those, really, there's always the rapid breathing rate, especially while sleeping, or the efforted breathing, where you see cats taking very big and very deep breaths every time they breathe in. If you're seeing something like that, that would also be another suggestion that we might have some type of heart or pulmonary lung type situation going on that we need to address. So with the cats, the biggest thing to do is to watch them for being themselves versus not being themselves. When they stop being themselves, we just have to ask ourselves the question, why? And sometimes that why may be that they're dealing with something that they need our help with. Just little subtle things that we watch for. So if you want more content like this, please hit the like or subscribe button, and we'll get back to you soon. Thanks so much for stopping in.